My name is Teresa Graham, and I'm the head of global product strategy for Roche here in Basel. February 4th marks World Cancer Day, and it is the first year of the Union for International Cancer Control's new 3-year Close the Care Gap campaign. This campaign is designed to raise awareness about the numerous barriers that exist for people around the world in accessing the cancer care that they need. At Roche, we share the UICC's commitment to building fairer, more equitable access to cancer care for all. To mark World Cancer Day this year, we're specifically looking at liver cancer and what can be done to close the gap in relation to the prevention, diagnosis, and treatment of the disease. 90% of liver cancer starts as chronic liver disease, yet the majority of people are diagnosed with late-stage disease, resulting in a poor prognosis. With approximately 1 in 5 people globally living with some form of chronic liver disease, there is a significant opportunity to advocate for earlier and more regular screening so that we can disrupt the progression of chronic liver diseases to liver cancer. Today's panel brings together experts with very different perspectives on liver cancer, and I'm thrilled that they can share their own experiences with us so that together we can find opportunities to close the gap. So with that, I'd like to warmly welcome our guests and start off with some introductions. First, we have Dr. Dmitry Zanozin and his wife, Dr. Holly Workman, Raquel Peck, and Professor Lorenza Romasa. Dmitry, let's start with you. As someone who's been living with liver cancer in recent years, can you share a little bit about your personal experience of how you came to be diagnosed and what your journey was like after that?
I was actually diagnosed, I would say, by accident. What happened is I was actually feeling quite well and was really active. And I started running with the spring and noticed that one of my knees became swollen. So I sought medical help. And when no structural abnormalities were found with the knee, they referred me to a rheumatologist who ordered a number of blood work tests. As we looked more into it, it turned out that I was a carrier for hepatitis B and C. And with that, I was referred to the infectious disease specialist, and then they asked for imaging, ultrasound, and CT and MRI, and they showed that I had several cancer lesions in my liver. From there, we went to surgeons, and it took quite a bit of time for them to actually access the cancer lesions and to determine the exact pathology of the cancer. And even after that, there was prolonged uncertainty about what to do and how to approach the disease. So yes, it was a very difficult time, even just navigating the system and knowing where to go, and the weight. It really weighed heavily on my family and myself.
I can't even imagine. I mean, Holly, from your perspective, what was that time like for you?
It was hard. It was hard. It was frustrating. It was maddening. As a physician who kind of knew the system, how would anybody ever do this if they weren't a physician? And that was even just the surgeries. That was before we got to other treatments. And unfortunately, as physicians, we knew that the prognosis was really not good.
Dmitry was very healthy and active prior to his diagnosis, but we know that that's not the case for all people. And we do know that around 90% of liver cancer cases are diagnosed in people who have already had chronic liver disease. Lorenza, what are some of the risk factors for liver cancer that people should be thinking about?
The most important risk factors for liver cancer include chronic infection by hepatitis B virus and hepatitis C virus, alcohol intake, especially high alcohol intake, and especially in Western countries, metabolic syndrome that includes hypertension, dyslipidemia, diabetes, overweight, or obesity that is related to non-alcoholic fatty liver disease. And also we have other risk factors in Eastern Asia or Sub-Saharan Africa, like food contamination by aflatoxin B1. Considering these factors, we have the possibility to prevent liver cancer, treating this risk factor or avoiding these risk factors, or we can include patients with chronic liver disease under surveillance, and so we can try to diagnose liver cancer if this occurred at an early stage. But unfortunately, most of people, even with chronic liver disease, are not under surveillance. And so, as already mentioned, in many cases, in too many cases, the diagnosis is at a late stage or intermediate stage when surgery is not an option for too many patients.
So Lorenza, I think that's a really important point that, despite the fact that so many of these patients have chronic liver disease, they're just simply not being cared for through the course of that disease. So Raquel, could you tell us a little bit from a patient perspective why you think this is the case?
Yeah, sure. I would cite a huge lack of awareness, but also lack of appropriate monitoring, such as just like Lorenza mentioned. Given that typically there is a lack of early symptoms when you do present with liver cancer. So by that, I mean no major signs until the disease is advanced. If those two things are not in place, meaning good knowledge and then good screening and monitoring, then we have a perfect recipe for those late stage diagnoses that we see.
Does awareness vary across geographies? Are there some countries or parts of the world that have better patient education programs than others, or that might be a model for countries thinking about doing more education?
Yeah, sure, absolutely. So for example, there are some countries in Asia that are doing very well. Japan, China, South Korea, Taiwan as well, where traditionally they would see very high rates of liver cancer because of their high levels of hepatitis B and hepatitis C, but where then they introduced robust screening programs, but also those patient education programs. And now what they're seeing is that the trend is finally coming down, whereas in other parts of the world and in different countries, this trend continues to go up.
So to that point, exactly, Raquel, more than 80% of liver cancer cases actually occur in low resource and middle resource countries. Are there unique challenges that patients in those parts of the world face?
Yes, so many challenges. And I start with the lack of. So we have lack of awareness, lack of diagnosis, lack of resources, lack of treatments. You have a medium survival time from treatment initiation of 60 months in Japan, 33 months in North America, 23 in Europe, and then 3 months in sub-Saharan African countries. And I mean, that is absolutely appalling. And you've mentioned yourself, Teresa, that the theme for World Cancer Day is close the care gap. And here you can see, how incredibly synergistic that is, because we definitely need to close that care gap when it comes to liver cancer.
Even in higher resource areas of the world, we know that there is some stigma to chronic liver disease. And so it can often be overlooked, which can result in big delays from when a patient first seeks help. And we heard a little bit from Holly about the impact that had for her.
Stigma is always a massive barrier. And what's key here, I think, is to educate people. And storytelling is incredibly important. And that's why I think it's so great to have, Dimitri and Holly here today sharing their experiences.
Yeah, absolutely. Both Dimitri and Holly mentioned the practices or the challenges in navigating the healthcare system as clinicians. Lorenza, could you share a little bit about what the typical patient treatment pathway looks like? I mean, how many different specialties and departments might be involved in the treatment of one patient?
Yeah, unfortunately, the pathway is not so well defined everywhere. And as you mentioned, patients are treated or are dealt by several physicians. I mean, starting from the primary care physicians, and then maybe the radiologist for the diagnosis. Maybe they have the ultrasound specialist, and then the radiologist for CT scan and MRI, and then the gastroenterologist or hepatologist according to the different countries. I think that the optimal way is to have a multidisciplinary team where all the physicians that are involved in diagnosing and treating liver cancer work together.
That's kind of exactly what you go through, and that multidisciplinary approach is just not available in so many parts of the world. Raquel, what's the impact of patients, both in terms of their treatment and psychologically, in encountering so many different healthcare professionals in navigating that labyrinth?
Well, it is a labyrinth. And as you said, the situation can be very hard, it's confusing, at times frustrating for the patients who are already in a very vulnerable position. And unless you have like a very well organized and humane approach to this, you don't get great outcomes. Last year, IEPO, which is a community of patient groups from across the globe, they've published this position paper on humanizing healthcare. And that looks into the importance to rebuild healthcare systems around the need of patients. And that includes basically working hand in hand with the patients and then all the stakeholders to basically create a more personalized approach, which is so key to those good outcomes that I've mentioned.
That IEPO paper really is an extraordinary piece of work. So if you haven't had a chance to look at it, it's definitely worth taking the time. Dimitri, with your firsthand experience, if you could make any changes to the healthcare system as you encountered it when you were diagnosed, what would you prioritize? Where would you suggest that we put our efforts first?
Well, I obviously I quite agree with what you guys were saying, that it's being a very complex issue. This certainly requires a multidisciplinary approach. However, also in this, the tricky part is that it's very easy to kind of get lost in the shuffle when so many people are involved, when so many cooks are in the kitchen. That's what I experienced, that people looked at me as a palliative case. We actually had to go outside of our system and consulted the Mayo Clinic.
That's just heartbreaking. But thank goodness you had the resources to actually go and actually have a different outcome. We have the power to close that gap. Lorenza, thinking back to some of those risk factors that we just talked about and that you mentioned at the beginning of our discussion, the advent of major hepatitis B vaccination programs does offer us the opportunity to tackle one of the leading causes of liver cancer by preventing people from developing the disease at all. Are there other things that can be done to prevent people from ever developing liver cancer?
Sure. We have the new antivirals for hepatitis C, the direct-acting antivirals, and they can completely abolish the viral load, and they can cure patients with chronic hepatitis C. I mentioned HIV, and we have the antiretroviral therapy for people living with HIV. We can and we have to promote lifestyle changes. We can do campaign to reduce or avoid the alcohol intake and to promote a healthy lifestyle with exercise, decrease of body weight.
And while we know that we can take rapid action to prevent many cases of liver cancer, unfortunately, there will be some who are diagnosed. Raquel, what can we do to collectively ensure that each person has the best possible outcome?
Well, we really need to start optimizing knowledge and access to treatment. And I just wanted to say that the story that Dimitri and Holly shared with us is really compelling. It has challenges, but it's not entirely reflective of the situation faced by most liver cancer patients. I mean, Dimitri had privileges that supported his journey. And I do use this word privilege here very carefully and very humbly, as I know it's no privilege at all to be diagnosed with any disease, let alone cancer. But from what we understand, on his side, Dimitri and Holly had network, resources, knowledge, geography even, because they live in a country where despite the challenges, they could access surgery and treatment. And we simply cannot just wait for the stars to align like this for every single patient out there. And in fact, we know that they don't. So I believe that we need to collectively share responsibility, to work together. And it's really great to see in this call patient, doctors, patient advocate, industry. But we need even more people to join the conversation. We need policymakers, we need researchers, and so on.
And finally, Dimitri and Holly, as folks who've gone through this experience of getting a liver cancer diagnosis and fortunately are now doing well, are there any messages that you would like to share with the broader liver cancer community, folks who are going through this now?
I think the biggest things that I've learned And you're right. I wasn't a very lucky guy because I had support of my family, which was tremendous. And for me, it was just very grounding to just think about every day as it comes, and count my blessings on that day. And even now that I'm kind of out of the woods now and in a significantly better position, it still continues to be my motto.
We asked if he could be assessed again for a transplant, and he had a transplant on July 31st.
That's fantastic.
So after 2 years of what we thought was what we were told repeatedly was palliative only therapy, he got a transplant, and based on the pathology from the transplant, they are calling him cured. We shall see.
Absolutely. Well, Dimitri and Holly, thank you so much. It's been such a privilege to talk with you and hear your experiences. Education is so critical throughout this entire journey, both all the ways that we need to educate people to prevent folks from ever getting chronic liver disease, but then to make sure that if unfortunately folks do advance to liver cancer, that there are many different things that we can do for people. But oftentimes, if we can't ask the right questions, we don't ever get to the best possible outcomes. I think for those of us who've been in the healthcare sector for a while, we know that care has to be delivered at the community level. We have to think about this in terms of what's happening in each country, in each institution, in each specialty, and how can we really reshape the ways that we approach giving care so that we're really putting the patient truly in the center of all that's happening, and are we making sure that we're doing all we can to get to the best possible outcomes for people. It's my hope that in 10 years no one is ever getting a diagnosis of HCC, and that we are able to close that gap for those who may still be who may still be touched by it. So thank you all again for joining me today and for helping to raise awareness on such an important topic in liver cancer. And let's make it all our goal to close the gap for patients around the world. Thank you so much for your time.